Good to have you along for Thursday, the 6th of October. TSB, Talk Sport Business on Talk 100.3. October is Breast Cancer Awareness Month, and there's so many great community events and fundraising events that are happening right across the city. The Marriott Hotel are doing a lot of high teas, which for Pinktober, which I went to, and you're going to one next week, aren't you?
I'm going on the 10th. No, you're right. It is about the awareness, Kitch. More often than not, people tend to not talk about it, and thus the spread of any infection, disease, or conditions, increases because people don't want to talk about it. And with campaigns like Pinktober, what we're doing is for this entire month, we're talking about it. We're talking and probably breaking that little shackle of that I'm probably intimidated about this, or probably I'm shy to talk about this. We're trying to break those barriers and speak on a public forum to reach out as many as possible.
I used to live in an Australian city called Wollongong, and they released a line of pink thongs for Breast Cancer Month, and it was called Thongs in the Gong. Thongs meaning, flip-flops, slippers.
Yeah.
Don't know what else you might be thinking of. But that's what we call them in Australia. But for more details on October being Breast Cancer Awareness Month, we're joined by Dr. Dana Haddad, who is a diagnostic radiologist with a specialty in breast and oncologic imaging, and she is the head of breast imaging department at Healthbay Polyclinic in Dubai. Thank you for joining us on Talk 100.3.
Hi, Neil and Kitch. Thank you so much for having me.
Well, thank
you. I really
you.
appreciate it.
No, you sound like you got heaps of energy. Is it been a good day for you?
I'm excited to be on your show today, and just excited to bring awareness to this. And I was just laughing at your story about Wollongong. I actually visited Wollongong. I'm a New Zealander myself, so I relate.
You don't sound like a New Zealander.
No, I'm complicated. I spent about 12 years in New York, so my accent's a little bit whacked now. But what to do?
And now you're in Dubai, so you're a true citizen of the world.
Absolutely, global citizen. I think most of us in Dubai relate to that.
Now, this is amazing. The way you sound excited. I wish both of us put together could bring out that energy on the show.
I think you do. You definitely do.
Well, when it comes down to it, Dana, on that, I mean, you've had experience in New York and obviously in New Zealand. October being Breast Cancer Awareness Month is celebrated globally. But what do you think here in the UAE we do really well when it comes to Breast Cancer Awareness Month? And where do you think we could probably improve awareness?
Absolutely. I think the UAE has been an amazing champion for women's empowerment and women's health in general. There's so many initiatives out there. We have Emirati Women's Day just passed in August, as we all know. So I think a lot of us are aware of that it's Breast Cancer Awareness Month, but I'm not sure if the education really is really out there with regards to the nuances of what it means to be breast self-aware, what tools are out there to be able to screen, what age to actually screen. There's a lot of confusion at that. So I think we could be a little bit better about bringing awareness as to the education information associated with breast cancer awareness.
So when it comes to breast cancer for women, where should people be breast self-aware? Or where should they know the risks, or when maybe they might be at a heightened risk compared to others?
Absolutely. So I think being breast self-aware involves knowing what your lifetime risk of developing breast cancer can be. And that involves a lot of different things, knowing your particular risk factors which are in your control, some risk factors which are not in your control, your family history. And I think also part of it is knowing that it's totally okay to feel your breasts and know what your breasts feel like for a woman. You and your doctor are your best chance of finding things as early as you can. It's important to check your breasts every month. And as I think you were saying earlier, there shouldn't be any shame involved with this, unfortunately, all too common disease in our community. And it's a very, very big problem in the UAE. It comprises 40% of cancers in women and 23% of all cancers combined. So it's still the number one cancer if you combine males and females together. And one more thing to know as well is that males can actually be affected by breast cancer, up to 1% of cases. So I think also awareness for all the males out there in the community.
Well, yes, I mean, see, everyone who thought that, breast cancer was only associated with the women that are around us, be it in our family or whatsoever. For the men also, we need to ensure and understand that, hey, it is not exclusive to the women. It is, inclusive for literally everyone who's around here. But tell me something, what are the stats, as far as men or women are concerned?
Absolutely. So as I was saying before, 1 in 8 women, unfortunately, will develop breast cancer in their lifetime. So that's an average risk of 12.8%. And if you look globally at WHO statistics, the case of breast cancer is literally diagnosed every 19 seconds. So if you just stop to think about that for just a second, I mean, that's a very big problem. And then on top of that, a woman dies from breast cancer every 60 seconds. So unfortunately, despite our advances in treatment and technology, this remains a very, very big problem in our community. And then in the UAE, it is about 23% of all cancers diagnosed and about 40% in females. Number one cause of cancer in the country, number one cause of cancer-related death in this country and in the entire world. So it's definitely a topic of concern.
How much do you think there's an impact when it comes to being a topic of concern is because we don't really have the older population here. Most people do tend to go back home past the age of 60 when their risks are increased. So they're not, they don't have mum or dad or grandma kind of telling them and reminding them or witnessing them. Do you think that has a problem when it comes to awareness around cancers?
I absolutely do think so. And this is actually a very, very good point that you're bringing up. I think a lot of us in the UAE, we tend to be a younger population here. The population of people above the age of 65 is actually less comparatively to the rest of the world. Mm-hmm. Having said that, this breast cancer still occurs in younger women, and we're seeing cases earlier and earlier. So we're seeing cases in the late 30s, and the recommendation to start screening is at 40. So just because you might not be in the older generation, it doesn't mean that this doesn't affect you. And I think it is very important for us all to be leaders in our community and just remind each other about the tests and the checks that you need to do to maintain your health. I mean, without our health, we can't do everything else that we want to do in our lives, and it's important to love yourself enough to make sure that you get screened so you can take care of yourself, your family, and go out there and find your dreams.
Well, you're speaking to two blokes, obviously, two guys here. Now, you mentioned there that it does affect 1% of men. Now, on a serious note, as a guy, what should I be doing to check if maybe I need to get looked at?
I think it would be important for men to check their breast area. I mean, we're all born with breasts, and the only difference between males and females is that we're exposed to estrogen during puberty, and that is why we develop breasts and males don't. But males in general do have very tiny amounts of breast tissue. And
some more than others, we know that.
Exactly. And no, absolutely. That is absolutely true. And if you do notice a lump or bump or change in your breast, change in your nipple area, any discharge coming out of the area, this is for both males and females. And anything under the arm that might be abnormal, such as swelling. I think a lot of women don't know, but we can have accessory breast tissue under our arms. So a swollen lymph node may manifest under your arm, or even an actual cancer under the arm might manifest. So it is important to check yourself. It's important for men to just be aware that this can also happen to them, although less commonly. And usually it's associated with a gene mutation, and males can carry a gene mutation that can be passed on to their children as well. So these are all very important points to be aware of.
Right. You mentioned about lymph nodes. Lymph nodes also look like it's a mass or of tissue that is under your skin or something. Does it always point at tissue cancer or something like that?
No. So that's actually also a very, very good point that you bring up. So if you do feel something in your breast or under your arm, don't panic and automatically think that this can be something serious. This could be just a swollen lymph node that could be reactive. We've seen a lot of cases, for example, when we've had COVID immunizations over the last couple of years. That causes swollen lymph nodes as well. So absolutely, not everything that you feel in your breast is going to be cancer. It's not going to be serious. Actually, the good news is most of the time it is just benign. But it is just important to check yourself. And if you do feel a change or see a change, just go get it checked out and make sure that you're okay.
Yeah, it's a good reminder. I do get the phone call every year from my mother saying, "Have you had your skin cancer check?" Being an Australian,
from Australia, yeah.
And we have to do it. And I'm like, yes, mum, I've got to do it. So it's important. We've all got to get the checks.
Yeah, especially in Australia, they're very aware of that. So,
very aware when it comes down to it. Now, other things that we need to be aware. I mean, the obvious ones are, your lifestyle choices. There are certain things that smoking and being in excess of too many things can impact you. So that's the first thing we've got to look at is cutting out smoking, don't we?
Well, actually, smoking hasn't been directly related to breast cancer, although cutting smoking in general is very good for your health, and it improves a lot of different areas of your life and is associated with certain types of cancers. Now, smoking has been correlated with an increase in breast cancer, but it hasn't been statistically significant. So some of the risk factors that we really do hone in on with regards to breast cancer is, unfortunately, being female and getting older. So those are the two biggest risk factors for developing breast cancer. And as you can see, that's something that's not really in your control. But some modifiable risk factors include limiting your alcohol use, maintaining a healthy weight, adding exercise to your routine, eating a healthy diet.
So basically moving out of Dubai.
Well, absolutely. Yeah. So, it's...
I want to ask you this, Dana, that is this like a mandate to every single doctor once you sign your final thesis and give it, that before you wear your apron and go out in the world with your certificate being a doctor, does every teacher tell you that, listen, every time you speak to anyone, please tell them about healthy lifestyle, do some exercise, eat healthy food? Because every doctor, including my dentist, tells me that, listen, you need to eat well, you need to do some exercise, you need to take lesser stress and, no smoking, lesser alcohol and all of that. Is like a mandate?
Sometimes I feel like it could be a conspiracy theory.
I know.
They just don't want us to have any fun out there.
Seriously. It's primarily because doctors, while studying, don't get to have fun. And that's why they want to, put it onto everyone else around them.
Listen, it could be, but, you never know what we're doing behind the scenes either, right? So, yeah, but listen, I mean, I am very passionate about the topic. I'm a big advocate for a healthy lifestyle and healthy lifestyle choices. And I think it's important just for your overall, not just physical well-being, but your emotional well-being, your mental well-being, and just to be there with your family and then just enjoy life. So it's just try to love yourself enough to just take care of yourself enough. I think that's kind of the message that maybe we should be promoting instead of just a set of rules.
Yeah, Dr. Dana, when you mentioned those two risk factors for females with breast cancer, the idea of being female and getting older are the risk factors. Every Sunday morning in Dubai, I certainly feel like I'm getting a lot older. It's sort of getting more and more, it's affecting us more and more. But no, on a serious note, we think this is a fantastic thing. It's great to be able that we can openly speak about this. October is Breast Cancer Awareness Month. And I mean, to give you the advice, obviously you've got the websites, but the best point is just to go to a doctor or go to a GP if you've got any questions or you want to get checked out.
Absolutely. And it's just very important to get screened. Prevention is better than treatment. The very short message that I'd like to say is that if you are 40 and above and female, I really recommend getting a mammogram for screening. There's controversy about how often and how early, but in general, if you're 40, you should get your mammogram every year. Just choose your self-love month, get your screening done, get your blood test done, get your pap smear done. And then you're done for the year. And then that, by the time next year comes, God forbid, if anything is found, it's probably going to be early. And then the other part about it is just knowing that if you might be at a higher risk, it is good to get a risk assessment. There's a lot of tools out there. So, for example, the Gale model, you can go Google it and just figure out what your risk might be if you're at higher risk. If you have a first-degree relative that was diagnosed at an early age, you may need to screen earlier. So just have a really good conversation with your doctor. Be aware of yourself and your health. Advocate for yourself. Yeah, those are the messages that I think are the most important this month.
No, this is extremely amazing the way you have put it down, simplified. This is an extremely complex, conversation, but you've simplified it to the T. Talking about the risk factors and then breaking it down to just two factors, women and age. And then, how do you take care of it? This is so amazing. Thank you so much, Dr. Dana Haddad, for joining us today and having this conversation.
No, and thank you so much for bringing awareness to this really important topic. Really appreciate it. Thank you.
It's good to speak to you. You too. October is Breast Cancer Awareness Month, and that is Dr. Dana Haddad, who is the head of breast imaging department at the Healthbay Polyclinic